Hi, I'm Anidora, the podcast producer for What Is Your Story. When we first spoke with Solape, she was eager to share her journey, a journey that's been deeply impactful for her and one that moved us as well. Her story stood out because it highlights just how unpredictable life can be and how we often don't realize the value of something until it's at risk. That something could be anything: your health, your finances, your family, or your peace of mind. This is a story of tenacity, resilience, and learning to navigate life's uncertainties. Solape opens up about being diagnosed with these rare medical conditions, her path to recovery, and how she came to embrace her scars, both physical and emotional. I think too often we have little to no idea of the silent battles that the people around us are facing or have faced. We do hope that in listening to this episode, you begin to see everybody that you encounter as a fellow soldier of life, just like you. We hope that at the end of this episode, Solape's story gives you a new perspective, one of empathy, strength, and especially of hope. If her story resonates with you, we'd love to hear from you. Leave us a comment, share your thoughts, or even better, reach out if you have a story of your own to tell. You never know who needs to hear it.
You are now listening to an episode of What Is Your Story by Noisy Podcast. Enjoy.
My name is Solape Aditutu Adeyemi. I'm a creative writer. I'm presently the vice chairman of the Association of Nigerian Authors Lagos chapter. I have degrees in microbiology and environmental management, and this is my story. In 2008, I was diagnosed with, before the diagnosis, I felt ill. I was working in a pharmaceutical company. I changed jobs, so I'd barely worked for 2 months when I started feeling feverish. I had to go to the staff clinic. I was feverish, so I was given the malaria treatment to take, and I think 2 or 3 days off thereabout, but I got worse even with the medication, so I couldn't go to work at all again. And then I had to be admitted in a hospital in Ogun State because I was living somewhere in Mowe in Ogun State. So in the hospital, I just noticed that I became very anemic. My health status worsened. I was weak. I couldn't do anything. And then I was given a blood transfusion, which didn't sit well with me. Let me put it that way. Yeah. Eventually, with a lot of back and forth and everything, I wasn't getting better. Eventually, I had to be discharged. I was discharged. So I remember coming back home. My mom had to get a taxi, and I remember the taxi driver looking at me, gave me a very odd look. He said, my eyes are very yellow. Nobody's eyes should be this yellow. But I just brushed it off. Got to the house. I couldn't do anything on my own. My mom was the one doing everything. She would go to churches. Church members were coming to pray for me in the house. And I was attending Mountain of Fire Miracles then. So they were coming to pray for me. I was not getting better. I was always on the 3-seater in the parlor. Weak and all of that. Eventually, my mom had to travel back to her station. And of course, she couldn't leave me because I was so weak. I couldn't do anything on my own. I couldn't bathe. I couldn't do anything. My mom has an adopted daughter, and she's a nurse. She works in Enugu. So we went the next day. And I remember before the walk from the house to the bus stop, I had to sit down. I just sat down by the side of the road. I told my mom, I'm so tired. I told her she was going too fast, which has never happened before. Because usually, if we are walking together, I'm always ahead of her because I walk really fast. Anyway, eventually we got to Jibowu. And we got the vehicle, we got to Enugu. So when we got to Enugu, at that time, while all this was happening, I admitted my right arm was swollen and I couldn't use it at all. It was swollen, it was mostly immobile, the right arm. And then the next day we went with Sister Chinri. She took me to the hospital. So we waited for long. Niger Foundation, they had lots and lots of patients. But eventually we saw this specialist. So he requested I do some tests and run an X-ray. So that was done, and eventually he told me that when the results came out that my blood was full of platelets and that I would need a blood transfusion. I was very anemic and it's likely I'll be needing a surgery as well. So eventually they called an orthopedic surgeon. He came in, examined the arm. He recommended that I have an operation to work on the arm. That there was pus, a large collection of pus in the arm. After the surgery, I just remember waking up on the bed back in the ward, and back in the ward, I remember I just felt very disoriented when I came to. I remember another thing that happened, which is striking, was when I woke up from the after the surgery on the bed, I noticed that there was a pipe inserted into my ball and socket joint that led to a large bag, a transparent bag underneath my bed. So the orthopedic surgeon said that when he entered into the arm, he did not know that there was so much pus in the arm. So that was what necessitated him inserting a pipe into my ball and socket joint there, and then so that the remaining pus there would drain into the bag underneath the bed. So eventually, I was discharged. My mom had to take me down to Cross River, where her base were taught how to dress it, because he removed the bag and said we'll be dressing it so that the pus in the arm will keep draining onto a sterile bandage with a plaster to hold it in. So he said we'll be changing it on a daily basis. So when I was in Mogoja, I was put on saline infusions, antibiotics round the clock. While I was in the hospital too, I was always on IVs, antibiotics, and different kinds of IVs and all of that, to control the infection, because then they told us it was acute osteomyelitis and osteoarthritis. So about a month again, we're due to go for a checkup. So we traveled back, and my appointment, I think, was the next day to see the orthopedic surgeon in Niger Foundation. So when we got there, I had to take another X-ray. So I took another X-ray, so he will see the state of the arm, and he looked at the X-ray, looked at the arm, and then just told me blunt, just like that, like so casually, the disease has progressed. It is now chronic osteomyelitis and osteoarthritis. And that day I felt, what is this man saying? Not with everything I've gone to, the drugs, the treatment, the IVs, the prickings, the pains, the everything. So that night he gave me a shot of the hydrogen peroxide inserted into the sinus. I was in excruciating pain. I couldn't even do anything. I was just crying. So recommended medications, then we left. I remember I almost fell into the gutter. My legs were shaking. So I called my mom. My mom said I shouldn't worry. I didn't know all this while that she would cry and cry and cry, but on the phone she would tell me, no, don't worry, all is well.
Are you enjoying the episode so far? If you love stories that make you feel at home, check out our anthology, A Man and a Woman and Other Stories. You can get a copy of this book through the link in our description box below or at Roving Heights Bookstore. Now let's get back to the episode.
You'll be okay. So she was invaluable to me. So I like I said, I came back to Lagos to where we're staying in Mowe, because I wanted my case files transferred to Igbobi, so I could see all that, because I thought I was disillusioned with the orthopedic surgeon there in Niger Foundation. I was disillusioned with the doctors' treatment. Anytime I talk about the arm, all the doctors there will tell me as if, the look they will give me as if, do you still think you have an arm? So eventually I got the referral. My mom had to be persuaded to let me come back alone here because she couldn't leave her duty post. I was better. Yes, I could say I was better. I could move around more and all of that. So I wasn't weak. I wasn't dizzy. My eyes were no longer yellow. So I started at Igbobi, and I got even more disillusioned because there was nothing new that they were offering, except for the constant go to the lab, go and run tests. All of this was costing a lot of money. I was on a permanent payroll for my mom, getting a substantial amount of money every month, for upkeep, treatment, transport, everything. So my visits were usually see the doctor, queue. If you know Igbobi, you have to get there very early, and then you spend like the day there. So basically, queue, see the doctor will ask routine questions. I remember another part of the arm got swollen in addition to the other arm, the sinus. And before I could say Jack Robinson, that night I was I sat up, the pus just started pouring from that other part of the arm. So I remember, because I didn't have enough bandages, so I started using tissue paper to mop up the pus because it was just pouring from the arm. So we're on this back and forth. My day would usually be go to Igbobi, come back, just eat, sleep, and read novels. So this went on for years. After a while, I noticed the arm was getting smaller in size. So I told a family friend. So I told him, then he said I should go for physiotherapy. I should tell the doctor. When I told the doctor said, the pus is the most important thing. I should let the pus stop. Why am I bothered about the size of the arm? I said, but it's getting pretty small. So I told him I just told him I was going to register myself without their recommendation for physio. So thankfully, they have a physio department in Igbobi, so I registered myself. They'll pass electricity into the arm. My Jesus Christ. Terrible procedure. I'll be in pains, crying, because to stimulate the nerves in the arm and all of that. So, and then I'll go to the gym, try to strengthening exercises for the arm and all of that. So, this went on back and forth. I still remember one physiotherapist calling me one day, just called me and said, Solape, this thing that is doing you is more than meets the eye. You need to go and look for something to do, sort yourself out somehow. If it means going spiritual and all of that, as a lady, your chances of doing this, your chances of doing that are pretty slim if you have this kind of issue. And I cried that day. I was like, I should even get suko. I'm telling someone is telling me to go out, to go spiritual or go and see something. Then the chief consultant one day, I was there. He said, I met with him and he said that they want to do another surgery. They'll go into the arm, bring out maybe what's pulse and all that. And I said, okay, if you are going to go into the arm, what are the chances that the arm will not be flailing? When I say flailing, as in, those arms that have no life, that become like as thin as bone and will just be shaking. You have no control over it. He said that he cannot guarantee that the arm will not be flailing. Immediately, I felt I ain't doing this operation. Anyway, whatever it is that happens after the surgery, you understand, it's all on you. And she said I should not entertain that idea of doing a surgery. So that was my last day. I never went back to Igbobi. People were praying along with us. One day I went to get something from my neighbor's place, and usually then, because of the physiotherapy sessions and all, and the passage of electricity into the arm, I would wear a sleeveless top and use a shawl to cover the arm. So that day I went to get something. I don't know. I think I bent down to pick something and the shawl slipped off my shoulder. The plaster was, sewn. They swabbed the bandage and the plaster. And the woman, my neighbor's wife, said, when will this pus stop flowing from this arm? I remember I cried. There were moments when I just felt maybe, let everything end. Let it all end. I was frustrated. There was a day I was lying down on the bed. A pastor was praying with me. Something just told me, and I feel it's the voice of God that said, why don't you try raising that arm up? Because prior to that time, I wasn't raising the arm. I was just trying to get by. And really, I raised the arm. I just started screaming at night, I can't raise it. Gradually, the sinus closed up. There are scars all over the arm. There was a time I kept hiding it until I went to see a friend. And the husband said, the shawl that I used to cover it slipped. The man said, why am I hiding my arm? I said, the scars. He said, the scars look like dimples. Why am I hiding them? And that really boosted my confidence. Since then, I wear lots of sleeveless now. Anybody can look at the scars. Some people stare at the scars. And I just smile. To myself and say, you don't know the story. You don't know the half of it. You don't know the pain, the tears, the frustrations, the depression, and sometimes almost suicidal thoughts that came with all of this. The bottom line is I'm still standing. I'm standing to the glory of God. I'm just thankful. The arm is, like I said, it has scars and not as strong as the other arm, but I'm thankful for that God's grace and mercy found me. So I just want to encourage people. I don't know what you are passing through. Know that God still loves you regardless. That's my story.
We hope that you enjoyed listening to this episode of What is Your Story by Noisy Podcast. If you would like to be a guest on this show, click on the link in the description box below. Don't forget to share, leave a comment, and like this episode. Also follow us on social media at Noisy Streets. Okay, see you same time next week. Bye.